So for today's video, I want to talk to you about specific things that people with darker skin can do to minimize their chances of having a really bad result from this virus. I'm very frustrated to see all the news stories coming out about African Americans and Latin Americans, etc., getting this disease and dying at a significantly higher rate and blaming it on being poor or blaming it on having comorbidities, but not getting specific into what's different about that population that they can do that makes them have a better outcome versus not. So let's talk about that. So what I'm going to do is talk about these comorbidities first and then wrap it up with what's specific about having darker skin that may be putting you at a disadvantage. So first of all, you keep hearing that folks with darker skin have higher rates of high blood pressure, diabetes, and asthma. So the first one is high blood pressure. It's really important to have your blood pressure under control, because if you don't, when you get sick and stressed, those folks are more prone to significant swings in blood pressure. So when you bring someone in for surgery and you're going to do anesthesia on them, if their baseline blood pressure is out of control, we often cancel your case until you get controlled, because when you go under the stress of anesthesia, you have sudden spikes in your pressure and sudden drops. And if your pressure spikes to 240 over 120, you have a very high rate of having a stroke, and that's bursting a blood vessel in your brain. So when you hear about people having strokes or having heart attacks, a lot of that is related to the lability of their blood pressure. And that's why it's important to get that done. So even if you're poor, even if you're on Medicaid or have nothing, there are community clinics that you can go to and get treated for your blood pressure. It takes a good 2 to 4 weeks of sustained treatment to get your blood pressure under control, but get it done now. And if you get sick, the chances of this getting out of control and dying from it go down. So that's important. Get your blood pressure under control now. I don't want to say it's easy, but there's tons of options now. And if you're compliant and listen, we can get this under control for you. The next one is diabetes. Diabetes impairs immune function. So the diabetic, the reason they get so sick is that the infection hits them and their body does not mount a response initially. So then the infection spreads to the point that it becomes an inferno. And then once their body realizes it, they go into an overreactive state. So you hear about this phenomenon of cytokine storm. That's because they're not attacking the virus right away, because their blood sugar's out of control, the infection gets out of control, and then by the time they react, it's too late. So that's another process where you have to be under control for weeks to months before it has an impact. And it's very simple. There's oral medications in addition to diet, there's injections, etc. Get your blood pressure under control. Third one is asthma. This is an obvious one. If you have chronic asthma and you're not on a regular regimen to keep it under control, then when your lungs get sick, you're more prone to having bad results. That's another one that takes at least 2 to 4 weeks of compliant with medication to make a difference. So get that one done. And the last one with darker skin is vitamin D. You need to be on a vitamin D supplement, and you need to know what your vitamin D level is. If you don't have insurance or you can't get it covered, you can get it done for cash for about $50 to $60, but it's really important to get that done. So when you have darker skin, you have something called melanin in your skin, which acts as a protective coating for sunlight penetrating it. So if you live in the tropics and you're bombarded with sun all the time, you need that melanin to keep your skin protected, to keep it from causing DNA damage. But there's still some getting through, so you get adequate vitamin D when you live in the tropics. When you live in Michigan or Philadelphia and you're getting no sun, that protective coating is now putting you at a disadvantage and you're getting much less vitamin D. And they've done multiple studies at people that have died from this, and across the board, they're showing low vitamin D. So you really need to be on a supplement, and I would talk to your doctor about that. The recommended dose is 800 to 1,000 microunits to start. I'm not sure the unit, I think it's called IUs. I take 15,000 units per day, and I've been doing it for a year. The normal range is 20 to 100, and I'm at 60. Now, if you take 50 to 60,000 units a day, you're at risk of toxicity. So don't go to that level. But anywhere between 1 and 5,000 units should be safe, and I can guarantee you that people with darker skin, especially if you're in a cold climate, are more prone to low vitamin D, which is absolutely important in your immune function and preventing cytokine storm. So for dark-skinned people, get your blood pressure under control with your physician, your glucose, your asthma, and get a vitamin D supplement. And then also add in the barrier protections that we talked about. the hand washing, understand how the virus works, etc. And I can guarantee you, you're going to shift your chances in a more positive direction. I know that was a long one, but there's a lot of information there, and I hope you found it useful. Thanks.